Welcome to this Lab 8 pre-lab video. Today's lab will be about the cardiovascular system. In this lab, you'll be examining the structures of the heart, looking at the flow of blood through the heart, and a second video will introduce you to blood typing. Let's start off with looking at the heart as an organ. As you may be aware, the heart is a hollow organ, and as such, there are layers. Nothing surprising there. And the three layers of the heart are as follows. The outer layer is referred to as the epicardium. You already know the epicardium by a different name. You know the epicardium by as the visceral pericardium. And as such, you know that that's a simple squamous epithelial layer. The middle layer of the heart, the thickest and muscular layer of the heart, is the myocardium. And you've heard of a myocardial infarction, an MI. We know that more regularly as a heart attack. That's when the blood flow or the oxygen availability to the heart muscle is deprived. The heart muscle cannot go without oxygen for a short time before permanent damage is sustained to the heart. The inside layer of the heart, lining the inside of the chambers as well as lining essentially along the valves of the heart, is the endocardium. And the endocardium is just like the endothelium lining all the blood vessels, and it too is a layer of simple squamous epithelium. Looking at the heart externally, while you can't see it from the outside, inside there are 4 hollow chambers. There are 2 atria, each one is an atrium, and there are 2 larger ventricles. The atria are the more superiorly placed chambers. External or attached to the atria is a big wrinkled flap-like structure referred to as an auricle, and you've seen that the outside of the ear is also called an auricle. So you've seen that term before in the ear. Atria are going to be receiving the blood into 2 places, into the right atrium and into the left atrium. You may know this term atrium means an entryway. Your home, your church, a business, the entryway might be referred to as the atrium. The right atrium, we're going to see, is going to receive blood from all over the body. That is what is called the systemic circuit, all of your body systems. And the left atrium is going to receive blood that has just come back from the lungs. It will be oxygenated blood, and that is from the pulmonary circuit, the vessels that go to and from the lungs. So as you look at the heart, we'll look at it internally in a moment, but as blood comes into an atrium on one side, it's going to pass down to the ventricle on the same side. The ventricles are the more inferior chambers. There are 2 large arteries associated directly with the heart, and one is the pulmonary trunk. The other is the aorta. We're going to see that both of these large arteries exit the heart at what's referred to as the base of the heart or the basal surface. The pulmonary trunk is going to be carrying blood coming from the right ventricle, and that is going to be going into the pulmonary circuit that is going off to the lungs. The aorta, instead, is going to be carrying blood from the left ventricle, and that's the blood that's going to be going into the systemic circuit that is going off to all of your body systems. So let's take a look at the heart. First thing I want to point out is that there is a rounded yet kind of pointed region at the bottom of the heart. This is referred to as the apex. The apex. And the apex is associated with the left ventricle. So that will be a really good landmark. When you see the apex, you know that you are in the region of the left ventricle. The other external feature that will help you with your orientation are the auricles. So here is the right auricle, this large flappy structure, and it is sitting directly over and actually connected to the right atrium down below. And then you see a glimpse here of the left auricle, and it would be covering the left atrium. Another thing that's very obvious when you take a look at the heart are the four great vessels. Now, there are four very substantial blood vessels that leave or enter the heart. Two of them are veins. Here's the superior vena cava. Here is the inferior vena cava. I'm going to draw this as an arrow to represent the flow of blood, the direction of the blood flow. The inferior vena cava is bringing blood up from really all points below the heart. Think legs and abdominal region. The superior vena cava is returning blood to the heart from everything above the heart. Think the brain and the head, the neck region, and the arms. There are two very substantial arteries leaving the heart. Number one is the aorta. The aorta comes up, does what's called the aortic arch, and then heads inferiorly, and you'll see it traveling behind the heart here and emerging in the bottom. That is sending blood to all points throughout the body. We will be learning next week about many of the blood vessels that branch off from the aorta, but you see here three coming off the aortic arch. Those are going to be heading to the arms and to the head. We'll discuss that next week. And then the other significant artery coming off from the heart is the pulmonary trunk. And just like a tree trunk, the pulmonary trunk is going to split into its branches. And we have here the left pulmonary artery and the right pulmonary artery. That blood is heading off to the lungs to become oxygenated. Also, on the surface of the heart, one sees a number of smaller vessels. Collectively, all of the red arteries are the coronary arteries. These coronary arteries are the supply of blood to the heart muscle. If any of these was damaged or blood was not traveling through these, then a portion of the heart muscle would die, as in an MI. There are also a series of cardiac veins. You see the blue veins, and they are carrying blood from the heart muscle back to the heart, and we'll discuss those in a moment. Now, internally, let's take our attention now to the structures within the heart. And within the heart, again, there are four chambers. There are two atria on the right side and the left side. And there are two ventricles, again, right and left ventricles. We're going to be looking at the flow of blood through the heart. So this is a cycle, a pattern of blood flow through the heart. And to help make sure that blood only moves in a forward direction or in one direction, there are valves. And we're going to be introduced to four different valves that help prevent the backflow of blood. If there is backflow of blood through a valve, then that is clinically referred to as a murmur. You may have heard of someone having a murmur. What that is a valve that's leaky. The next time you go to your doctor and have a checkup, notice that they will use their stethoscope and listen to your heart, and they will move that stethoscope to four different locations. Those four different locations are where they can best hear the four valves, and they're listening to make sure that the valves are opening and closing properly. So let's take a look at how the blood first enters the heart. And by convention, typically this conversation starts with blood entering into the right atrium. Remember, the word atrium means an entryway. And the blood that comes into the right atrium is venous blood. What that means is that this is blood that is not as rich in oxygen. It is drawn as blue in color. And it is important that as we go through this unit, that you do have a blue and a red pencil or a blue and a red marker in addition to something black. You'll need that here in a few minutes, but you'll also want to be labeling structures as we learn about the heart and the cardiovascular system using the conventional colors when appropriate. So the right atrium is receiving that venous blood, that blue blood, and it's coming from all over the body, from all of your systems. So we call this the systemic circuit. And there are three ways by which blood gets into the right atrium. Number one and number two, you've already seen. The superior vena cava, bringing blood back from the head and the arms. The inferior vena cava, bringing blood back to the heart from the lower limbs and the trunk. And then thirdly, coming back from the heart muscle itself, there's a vessel referred to as the coronary sinus. We'll see how this drains back into the right atrium. In between the right and left atria, there is a wall, a muscular wall, and that muscular wall is the interatrial septum. You can break that down. Between the atria, there's a divider, right? A septum, just like your nasal septum that separates your left and right nasal passages. Blood will be moving from chamber to chamber through contraction of the different chambers. So when the right atrium contracts, as that muscle contracts, it will force open a valve, and that valve is the right atrioventricular valve. It tells us, right, that it's on the right side, and that it's between the right atrium and the right ventricle. So this valve names itself anatomically. This valve is made up of three flaps, three pointed structures. So it's also referred to as the tricuspid valve. So you will need to know both of those equivalent terms. So the blood that leaves the right atrium is going to travel through this tricuspid valve down into the right ventricle. When that right atrium stops squeezing, the valve will close once again, and that will prevent backflow. Now that blue blood, that venous blood, is now down in the right ventricle. In between the right and left ventricles, there's also a dividing muscular wall, and that is the interventricular septum. And of very great significance is that in the ventricles there are going to be muscular projections, cone-shaped muscles referred to as the papillary muscles. This is probably the fourth different papilla or papillary structure you've seen in the course, and you know that papilla refers to nipple-shaped structures. So in the right ventricle, we're going to see three of these papillary muscles. And at the end of these papillary muscles, there are going to be long, strong, tendinous cords, referred to as the chordae tendinae. And the chordae tendinae are going to be holding onto the valve and preventing it from flipping or inverting. If a valve were to flip or to invert, then it would no longer be an effective valve. As the right ventricle contracts, the blood will now be pushed into the pulmonary trunk. It'll get to the pulmonary trunk by passing through another valve, the pulmonary semilunar valve. You'll also just have it referred to as the pulmonary valve or the pulmonic valve. In that pulmonary trunk, as it leaves the heart, there's a narrowing of that pulmonary trunk into what's referred to as the conus arteriosus. And that pulmonary trunk will then divide into the right and left pulmonary arteries. Again, this is carrying that deoxygenated blood to the lungs. It's entering now the pulmonary circuit. As I mentioned, the pulmonary valve is referred to as a semilunar valve. And there are two of these in the body. We'll see the next one in a moment. But the pulmonary valve and the aortic semilunar valve, both of these valves are thin valves composed of sort of half moon shaped sections. And we'll see both of these valves in our heart model as we start labeling structures. So as the blood leaves the right side of the heart, goes into the pulmonary trunk and then to the pulmonary arteries, what happens next? Well, this is the blood that is traveling to the lungs. So here is a lung. We're looking down into the microscopic structures of the lung. And while you haven't looked at this in detail, recall back in our histology lessons that we learned that the air sacs of the lung, these little grape-like, grape cluster sacs, each of these is called an alveolus, or all of them alveoli. And remember that they were lined by simple squamous epithelium, the thinnest of epithelium that allowed for gas exchange. So as air comes in to your trachea and then down into the bronchi and the bronchioles, the passageways, the air comes down and enters into these little grape-like alveoli. Around each of these alveoli is a series of blood vessels. And you see here both red and blue vessels. The blood coming into the into the lungs, look right here. The blood coming into the lungs is traveling on branches of the pulmonary artery. And remember, this is blue blood. So we see blue blood coming down, and that blue blood is going to go into the alveoli. There, oxygen from the atmosphere will enter into the blood. The blood will drop off CO2 as a waste product gas. And now that blood will take on a red color, and that red blood will return from the alveoli in small branches of pulmonary veins. And that blood will then return back to the heart. Now, when it goes back to the heart, that blood is going to enter into the other entrance to the heart, the left atrium. And this blood, everything on the left side, is going to be oxygenated blood. That is, it's going to be red in color. It's going to come in from those pulmonary veins and enter into the left atrium. There are 4 of these pulmonary veins, so 2 from each lung. Inside the atria, I didn't mention this earlier, but along the superior, the top border of each of the atria, you are going to see an arrangement of muscles referred to as the pectinate muscles. Again, you'll see this labeled in pictures and diagrams. From the left atrium, blood is going to pass down through the left atrioventricular valve. Now this valve, again, it tells us exactly where it is. It's on the left side between the left atrium and the left ventricle. But it has 2 other names. It's also referred to as the bicuspid valve, or even more commonly, the mitral valve. So please know all 3 names. Similarly, this valve will be held in place by chordae tendineae, attached to papillary muscles. The difference is here on the left side, there are only 2, right? There are 2 bicuspid. There are 2 of these papillary muscles strengthening and coordinating the movement of that valve. As blood passes through the left atrioventricular valve, the blood is now in the left ventricle. The left ventricle is the largest of the four chambers. It is also the most muscular. Its wall all the way around that left ventricle is about 3 times thicker than the right ventricular wall. This is a necessary muscular structure because this is the real workhorse of the heart. This is the chamber that's going to squeeze with tremendous force and under great pressure force that red blood, that oxygenated blood, all the way to the body system. So the heart has to pump that blood forcefully enough to send it all the way to your toes, if you want to think of it that way, right? Quite a distance, or even think about it having to work against gravity to go up to your brain. So as blood leaves the left ventricle, right, it is going to go through the aortic valve right about here and is going to enter up into the ascending aorta, go around the aortic arch, and then down the descending aorta. And again, next week we will name many of these blood vessels that are coming off from the aorta and going to different organs and regions of the body. Again, the bicuspid valve will have only 2 papillary muscles and those chordae tendineae. And again, everything in the aorta is going to be red oxygenated blood. So I'm going to draw what I call the square heart. And in your pre-lab, you are being asked to turn it over and draw this out as well. So for this, make sure you have a red pencil, a blue pencil, or something red and blue in addition to a pencil or a black marker. And as I change colors, please be consistent in doing this. This square heart is really just a way of learning the heart structures. The heart is complex. You've seen already that the left side of the heart is not identical to the other side. You're seeing in the nervous system that the left and right hemispheres of the brain are not identical. The lungs are not identical, left and right. Your 2 kidneys are not exactly the same size or directly across from each other in the body. So there's a lot of asymmetry, but especially in the heart. And it is especially difficult to try to draw. So the square heart has been a great way for me to teach the heart. And by doing so, I think it's really going to help you put this whole puzzle together. So I'm going to start off by just drawing a big black box. And this represents the heart in a kind of a strange way. And I'm going to draw in the 4 chambers. Let me label these chambers. The right atrium, the right ventricle, the left atrium, the left ventricle. Notice that we're looking at a person's heart, right? Right and left are that of the patient that you are facing. Let me put a couple landmarks on here. So here on the left ventricle, I'm going to sort of round this corner out. This represents the apex of the heart. Recall I said the apex of the heart is associated with the left ventricle, and we can see that here. I'm also, while I'm here, going to thicken the walls of this chamber. I mentioned that the left ventricle is the thickest and most muscular of the 4 chambers. So I'm just going to draw that thicker for that reminder and label this thick muscle as the myocardium. Right, that's the myocardium, the muscle layer of the heart. I'm going to do a couple more of these additions. I'm going to draw on the outside of the left atrium. That'd be the left auricle again, and here over the right atrium, I'm drawing a strangely shaped right auricle. The wall in between the right and left atrium, right, you can label that as the interatrial septum. And then this wall that is in between the right and left ventricles, you could name that the interventricular septum. I'm just using abbreviations here. I'm going to add a couple of valves. Here's a valve. These ovals are valves. And I'll explain what I'm doing here in a moment. But there are 4 valves in the heart. Okay, so that's the basic idea of the square heart. Now let's fill it in with the blood flow. I'm going to go to my blue pencil, and remember that blood comes into the right atrium. Blood comes into the right atrium by one of 3 ways: by the superior vena cava, by the inferior vena cava, or by a vessel in the heart called the coronary sinus. The blood that's coming in is venous blood, so it is blue in color. Now, it's not really blue. It's not blue in your body, but we see it as blue, if you will. If you look at your wrist, you notice that the blood that coursing through the veins is sort of a bluish color. Now, it's not truly blue in your body, but it is actually more of a deeper brown color, but we perceive it as blue through the skin. So we're going to use that blue coloring as a color convention in our cardiovascular system drawings. So the blood is now in the right atrium. The blood is going to come in, and the right atrium is going to squeeze, contract, and that's going to force this blue blood down through the right atrioventricular valve. So this valve, we can put a couple names on it. This is the right atrioventricular valve, or remember, this is the tricuspid valve. Now that blood is now down in the right ventricle, and we're going to see that there are 3 significant muscles that are going to come off the ventricular wall. Those are the papillary muscles. I'm going to just abbreviate them PM. And attached to those papillary muscles are going to be chordae tendineae, these very strong tendinous cords, looks like guitar strings, that are attached up to the valve. Remember that everything here in the right ventricle is still blue blood. When the right ventricle contracts, that blue blood is now going to go through this valve. Now, this valve is not actually placed here, but again, the heart's a pretty complex structure, and to draw it anatomically correct would require us to have a 3-dimensional drawing with some crisscrossing that's very, very difficult to do. So I'm going to continue to draw the square heart, and you'll see what's going on here in a moment. The blood, as it goes through that pulmonary semilunar valve, I'm just calling it the PSL here, is going to enter into the pulmonary trunk. So this is the pulmonary trunk. Like any tree, it's going to branch into its pulmonary arteries. So that blue blood now is going to branch into the arteries. And as we saw a moment ago, that blue blood is going to make its way to the lungs. So here is a very crude drawing of a lung, right? Now, in that lung, that deoxygenated blue blood is going to enter into the lungs, into those alveoli. And what you always see when you look at gas exchange in the lungs, you will see both the blue blood entering, but you'll also see the red blood that is being formed and is leaving the lungs. So now we're going to pick up our red pen, and we're going to draw both red and blue in the lungs. In fact, sometimes the lungs are drawn as purple for the mixture of the red and blue. So in the lungs, the blood is being oxygenated. Oxygen's being added to the blood, and when blood is more oxygenated, it is a bright red color. That blood now is going to leave the lungs, and it's going to come back to the heart and enter in the left atrium. So from both lungs, it's going to come back. Again, I'm just trying to draw this crazy square heart. It's going to come back into the left atrium. And the way it got there is through pulmonary veins. So these are the pulmonary veins, PV. The red blood that came into the left atrium, similar story, is now going to pass through, when the left atrium squeezes, through this valve. And this valve, you guessed it, is the left atrioventricular valve, nicknamed the bicuspid, or the mitral valve. As the blood enters into the left ventricle, a couple of things you'll notice. There are going to be two large papillary muscles. Those papillary muscles are going to have the chordae tendineae going up to the valve. Again, that's the bicuspid, so there's two papillary muscles and two sets of the chordae tendineae. When the left ventricle, which is the most muscular, contracts, it is now going to send blood out this valve. That red blood is going to pass through the aortic valve, or the aortic semilunar valve. And that blood is going to be forcefully pushed into the aorta. Just put an A on that. And the aorta now is going to carry blood throughout the body. And I'm just going to imagine it going off to the brachial artery, going down the arm, and eventually going down into the hand. So I'm going to draw a very crude hand here. Now what happens in that hand is blood has been delivered. So we'll draw some red blood getting into the hand. But as that oxygen is delivered and CO2 is picked up as a waste product, that blood is going to become now venous blood. So again, in the organs, you'll see purple. So we'll put some blue blood in the hand as well. And now, how is that blue blood going to get back? Bear with me as I draw this. There are going to be veins in the body that are going to return that blood back to the right atrium. So that is a very strange drawing, I know. There are a couple of significant faux pas, if you will, in this that hopefully you recognized already. One, the four chambers of the heart are not equal in size. So I admit that this is not accurate in that regard. The other thing that's probably even more significant is that the valves here, the pulmonary semilunar valve and the aortic semilunar valve, are not where they are located here in this square heart. Those two valves are actually up here at the base of the heart. But again, to draw that anatomically correct is beyond my artistic skills. I struggle to draw a square heart. So the purpose of the square heart is to help you begin to learn the flow of blood through the heart. And I have found through the years that this presentation helps students to sort of put this together. So what you may want to do is review these slides and draw your own square heart out as practice, as a way of just getting down the flow of blood, the major structures, the apex, the chordae tendineae, the papillary muscles, the valves, and begin to appreciate the overall flow of blood here. Now, in addition to drawing out the square heart either on paper or in your head, you certainly can also use a flow chart such as this. So in this flow chart, let's start where we did. We started with blood entering into the right atrium. And again, blood got there from the superior vena cava or the inferior vena cava. This particular table does not include the coronary sinus, so you might want to add the coronary sinus there. The blood then goes through the right atrioventricular valve. This particular chart does not list the tricuspid as an equivalent name for that valve. Into the right ventricle, into the pulmonary semilunar valve, into the pulmonary trunk, and then splitting into the pulmonary arteries. Notice everything across the top of this slide is blue, that venous blood. And then that venous blood travels into the lungs, where we see purple in color. That blue blood is going to be reoxygenated at the alveoli and leave out of the lung through a series of pulmonary veins, which are now red. Those pulmonary veins are going to return to the heart at the left atrium, and blood will then pass through the left atrioventricular valve. Again, two other names for that valve, the bicuspid or the mitral, into the left ventricle, through the aortic semilunar valve, into the aorta, and then off to all of your systems, all your peripheral tissues. Again, we'll be learning the names of many of these arteries that carry that blood to the tissues. And then from the tissues, that blood will be returned through a series of veins. So this little section right here, this little section right here will be a topic of next week's lab as we learn those arteries and veins that carry blood to and from your tissues. Once you've looked at the heart a few times, looking at a more complex drawing as this one should be very doable. There are 11 steps over here mentioned. The same 11 steps have been outlined in the slides, and you can now use your finger to trace through the blood flow through an anatomically correct drawn heart. Notice again, everything on the right side of the heart is blue. Everything on the left side of the heart is going to be red. So take your finger, trace through those 11 steps, and confirm that you understand the flow of blood through the heart. Just a couple of mentions about blood pressure. This will come up again next week in the blood vessel lab. But when the left ventricle contracts, that great forceful left ventricle, it is going to put a fair amount of pressure on the inside of your blood vessels. We'll learn next week that the arteries are designed to withstand that incredible pressure. And the heart is beating, 50, 60, 70, 80 times a minute. So your arteries are getting substantial pressure pushed through them, blood pressure. Now, this blood pressure is measured in units of millimeters of mercury. It is measured by an instrument called a sphygmomanometer. The sphygmomanometer is the valvular part of the blood pressure cuff that you've seen. And when you measure blood pressure, you're getting two numbers. The upper number, the numerator, is the systolic pressure. Systole means to contract. So the systolic pressure is the pressure put on your vessels when the heart is contracting. The bottom number, the denominator number, is the diastolic pressure. Diastole or diastolic refers to the pressure when the heart is resting. So in between heartbeats, how much pressure is on the arteries at that point? Average across all ages about 120/80. As young individuals, most of you probably have a lower blood pressure. As we get older, our blood pressure does naturally go up. We'll discuss more of that next week. The numbers you want to be mindful of in the clinic: if your resting systolic pressure is over 140, again, I want to emphasize this is resting, but if you are resting and your pressure on the vessels is over 140 millimeters of mercury, then your doctor is going to be concerned about hypertension or high blood pressure. Over time, that high blood pressure can weaken the arteries and lead to issues with aneurysms or bulging arteries or stroke or heart attack where the blood vessels give out. If your diastolic pressure is over 90, that's also of great concern. That means that there's a tremendous amount of pressure on your arteries even when the heart is not in a contractile state. So any number over 140 systolic, any number over 90 diastolic is going to be reason for concern regarding your blood pressure. We'll refer to this again next week, but at the aorta, again, your heart is beating at about 120 over 80, right? A lot of blood pressure. And notice that as the blood goes through your arteries, the pressure begins to drop. And all I want us to see right now is that by the time the blood comes back into the vena cava, the pressure is essentially zero. And next week we'll discover and figure out how is it that the heart is able to get blood into it, return to it, if in fact the pressure in the veins is essentially zero. And when one takes blood pressure, you use the blood pressure cuff. Again, the fancy meter that you're looking at is the sphygmomanometer. And what you're doing is you are cutting off, using the blood pressure cuff, you're cutting off the blood flow coming through the brachial artery. Now, you can take blood pressure in a couple different places, but more traditionally it's taken here. And the brachial artery is traveling through here. And that blood pressure cuff is blocking the blood flow through the brachial artery. As a result, shown here, the blood vessel gets completely squashed, right? Completely closed. The blood flow is blocked. That's why you don't want to leave that blood pressure cuff on for very long. As you begin to release the pressure on the cuff slowly, the brachial artery begins to open up. Now, there was a guy named Korotkov, and he described this phenomenon, but with using a stethoscope, you can hear the rushing blood through this partially closed brachial artery. And the first sound that one hears through the stethoscope is recorded as the systolic pressure. You'll continue to hear this sound with the stethoscope as long as there's any sort of blockage or reduction in blood flow through the artery. Once the blood flow pressure is restored to normal, you no longer hear the sounds. So as long as there's a blocked or partially open vessel, you'll hear these sounds of Korotkov. The first sound again is the systolic pressure. As the sound disappears, the last sound you write down as the diastolic pressure. So that's the basis of how to measure blood pressure. You'll be measuring blood pressure next semester in the physiology labs. That brings us to the end of the heart section. You'll now watch the second video on blood.